towards private healthcare affect poorer Israelis? And what do you see as a potential solution to the American healthcare issue? I mean, I'm coming from the perspective of being fresh off the boat and still getting used to the idea of there not being a national health service where it's just all taken for granted.
Okay, so since January 1st, 1995, Israel has a national health law by which every citizen, in return for an health tax that is stands at 4.8, let's round it up to 5% of the gross income, are paid as health tax up to a certain ceiling, by the way. The ceiling now is 7 times the average salary in the Israeli market, which means that if someone is making $1 million, not a year like you count, but in Israel we count by the month, $1 million a month, or is making $25,000 a month, they will pay the same, 4.8% of 25,000 as health tax. In return for that, the government guarantees, free of charge, a very impressive basket of services. By very impressive, again, is there an obstetrician in the audience? Or a fertility specialist? I'm sorry that I find myself bringing many examples from this area, but every Israeli citizen is entitled to 2 children. 2 children, not 2 cycles of IVF. 2 children free of charge if they have infertility problems. So this is a very extreme example that actually runs since Ben Gurion time. It has to do with the Holocaust. The Israeli government always had the policy to encourage large families, and it's manifested even today in the Israeli national health law. But I'll bring you another example. An Oleh Hadash, a new immigrant from Russia or from Ethiopia, let's take Russia because the example fits Russia, lands in Ben Gurion airport. He gets his citizenship on the spot, according to the law of return in Israel. Let's say that he's a heavy smoker, ate the beloved sausages of Moscow, has high cholesterol, and he has untreated severe coronary artery disease, and from the stress of the naturalization and becoming a citizen and landing in Ben Gurion airport, he develops a heart attack. He would be rushed, in the best scenario, to Shaare, Zedek, in the worst scenario, to some other hospital, and will have open heart surgery the same night free of charge. No, you don't have to wait. No tקופת הכשרה, I don't know how you call it, when you buy medical insurance and for the first... What?
Window period.
Window period. No window period. The window period was 1 minute.
That's not going to change.
And that law is not going to change. We have a public debate every year what new technologies to add to the basket and which to delete, because you're from England, I understand.
Sure.
So the NHS is collapsing financially, as we all know. Okay? And the difference between the NHS and the Israeli national, the NHS is the national health system in England. And the difference between the NHS and the Israeli national health law is that the NHS started in 1948, when Shlomo and I were born, or this is a secret. Okay? And the Israeli national health law started 16 years ago. Because that's the nature of modern medicine. The new technologies, devices, medications that are being produced, manufactured, invented every year is going up exponentially. And in Israel there is a special department in the Ministry of Health that is called the Technology Assessment Department. Every year in January, all the functionaries, the senior functionaries in Israeli healthcare system, including universities, scientists, are getting a letter from this Office of Technology Assessment, what new technologies they would like to include in the basket of services that is giving free of charge for the next year. They collect the data until June, they process it. By processing I mean evaluating the new technology in terms of saving lives, improving quality of lives, how many patients will in Israel, if it is released free of charge, if it will be included in the basket, how many patients will consume the technology, what will be the cost. Then towards the end of the year, the government decides how much it will allocate from the budget for addition of new technologies to the basket. Usually the sum runs between, in a bad year, 300 million shekels, in a good year, close to 1 billion shekels, and a special committee composed of physicians, scientists, philosophers, ethical people representing the public. Famous Rabbi Yuval Sherlock sits on this committee. I used to sit on this committee. People, around 19 members of the committee, and towards January 1st of the next year, they will decide within the budget allocated by the government. And the main task of the Minister of Health in Israel is to fight in the government to get as much money as possible in order to develop the basket of services. I think in terms of social justice, as an Israeli, I am very proud of that. We have no waiting times for surgery in Israel, as opposed to the situation in the UK. And I think the Israeli population is health conscious and educated customers. And again, it's from year to year, it's financially more difficult to go on with this system, and it will have to stop. Now it's quite impressive. There is private medicine in Israel for people who would like to, to come to the best surgeon, to come to the best physicians according to their view. It is not practiced in governmental hospital. Again, Jerusalem is different because Hadassah and Shaare Zedek are considered public-private hospitals. We are public in the way that we are not for profit. We are public in the way that we develop our services according to the needs of the community. Just imagine if we start losing money on our maternity and I pass a decision to close our maternity, 52% of mothers in Jerusalem will give birth in the street. So we are committed to the community. We are private because I was hired by an international board of directors, as opposed to Tel HaShomer or Rambam in Haifa, that the government appoints their directors, and they are tenured, by the way. The directors of governmental hospitals are tenured. I can be kicked out from today to tomorrow. So in this respect, we are private, and we allow our tenured full-time physicians to do in the afternoons private work to patients who want this specific surgeon or this specific physician. Yes.
So one of your original comments was that the American system is moving more to national health and the Israeli system is moving more to private. Can you tell me a little bit more about how the Israeli system is moving more to private? What are the changes?
Well,
what's motivating that?
There are more and more rich people who can afford services beyond the basket of services of the national health system, the national health law. That's one. And second, one of the basic problems that Americans cannot understand, and I can understand why you cannot understand, is that if you are admitted to a public hospital, including Shaare Zedek, which is public-private, and for instance for surgery, you cannot select your physician. You can do it in the frame of a private practice, that, as I said, exists in the afternoon in Hadassah and Shaare Zedek, does not exist in any other public hospital in Israel. So private hospitals are starting to develop in Israel. Many of you probably heard the name Asuta, which is a major private hospital in Tel Aviv, and the upper 10%, socioeconomically, 10% or 20% of the population will either buy supplementary insurance in a private, in addition to the insurance that they have as citizens of Israel, or they will pay out of pocket not only for cosmetic surgery, where it's obvious that you have to pay out of pocket, it's not included in the basket, but in order to have heart surgery with a surgeon of their choice, they will add out of pocket money. That's what I mean, and it's become more and more prevalent as the socio-economic situation in Israel improves. Now, why you move towards socialized medicine? Read the affordable health, affordable, how do you call the ACA something, the Obama reform, so you will understand. But again, in terms of social justice, it's not something to be condemned. From the eye of the director of a hospital or chief of staff of a hospital, it's a problem, because Shlomo just explained when we spoke before I came that you are talking about a zero-sum reform. So those who have no insurance now will be paid by Medicare, but the rates of Medicare will go down for everybody. So to run a hospital in this country is becoming more and more difficult, and to keep it financially balanced. But in terms of social justice, it's a justified law in my eyes. I would like to thank Jennifer.
Thank you. Everyone for coming out. I really, really appreciate it. I want to thank the Melnick family for hosting this evening. We already have our next salon confirmed for May 19th, featuring Dr. Dahlia Kay, Senior Political Scientist at RAND Corporation. Her topic is Regime Change from Within, Arab Revolts and U.S. Policy in a New Middle East. And we also have Ray Gross. She's a social media strategist. So I look forward to seeing you then, and I will send more information out. Thank you so much, and have a great evening.